sign-in sheet to call the names of who signed up to speak. And then when you come down to speak, you'll need to come to that microphone, and you'll have 5 minutes to do so. And at that 5-minute time limit, I will identify that your time is over, and you will need to reclaim your seat. Okay? When you do come to speak, what I need you to do is state your name clearly and then make your statement. And the transcriber will have that information recorded, and we will post this information on our website as soon as we receive a copy of it. The Division of Early Childhood Care and Development has sent multiple letters to providers and parents about the upcoming changes to the Child Care Payment Program and moving to the Mississippi Child Care. All provider and parent letters had a 3-page FAQ, which is available in the back. Is on our website for viewing. Accurate information about the changes and the requirements are posted on our website at www.childcareinfo.ms. And it's suggested that providers and parents read the material. This should be every provider's first source of information. There have been many misconceptions about the program changes that have been rumored. One of those is that the clarification of those is that Mississippi Child Care is not linked with any other system, only with Child Care. The information is stored in accordance with all state and federal required security elements. The scans are not prints. When a finger image is scanned, points from the image will be converted to a number and will serve as a personal identification number. The image is then deleted. The number is all that is stored in the system. No images are stored. This number will identify the person that can check the child in and out. If a person that helps with picking up or dropping off the child that does not want to have their finger scan registered to create a PIN, they do not have to go through the process. The parent will have to complete previous check-in and check-out for the child when this person picks up or drops off the child. Attendance and payment policies are not changing. We will not be paying for the hour for the attendance. We're not paying by the hour. We're paying as we are now. The information about trainings has been sent to providers via email address that they have provided to our office. Providers and parents are mandated to attend the training, and any parent or provider who does not attend the training will be made inactive in the system and ineligible for services and payments until the training is complete. It is easier to use the Firefox internet browser to register for the trainings with the doodle poll. Otherwise, enter a comment on the doodle poll with your name, provider ID, the date, time, and location of the training you would like to attend, and our staff will register you for the training. It is projected that we will spend approximately $1.6 million for the federal fiscal year 2013. The expenditures per year will be based on the program number of children that we have on the program per month.
Good.
We need to set all telephones to silence. We don't need to hear any beeps or noises to distract the speaker or with the stenographer. Our economic impact statement will be on the website tomorrow, and we will post responses that MDHS has to give to questions on our website. Okay. The first person that signed up to speak is Jane Boykin.
DECCD was fully aware of the Administrative Procedures Law, that it committed to follow that law in its application for federal funding to operate the State Early Childhood Advisory Council, and then failed to follow through on that. And why? Because we would not be here today if DECCD followed the law. DECCD via CSAC applied for the federal Race to the Top grant. It lost, a humiliating loss, last among the 35 states, not because our state legislature doesn't invest in early childhood programs, as some have claimed, but because it was a poorly thought out, poorly constructed plan that circumvented the authority of the legislature to increase funding to the member agencies of CSAC and likely to cover their failures to properly implement and successfully implement the QRS system. The DECCD efforts thumb their nose at state law and federal obligations, and that's important today because the only place that you find any written plan about e-child care or a time and attendance system is in that Race to the Top plan. It's not in our state plan, it's not in other documents. When you start talking about fingerprinting children, it's only in that one place. And why it's there is to do research to see if the attendance of children in an early childhood program, how that correlates with their school readiness. And there's a federal limitation on research involving human subjects. And I think particularly when those human subjects are our most vulnerable children. However, we have gone on and we've had this time and attendance system out here. And so I raise these objections. I object to e-child care for research or any other purpose and question the legality of a competitive procurement of a product that can only be provided by Xerox ACS. E-child care is the registered trademark service mark of the company, and without those two words, there are a large number of less invasive products on the market. I raise objection to the proposed reimbursement scale based on the provider's education. On the basis of such a system, the TEACH model was soundly defeated by the providers convened to develop the quality rating system. I raise objection to any and all elements of the payment system that incorporates elements of the failed QRS or the RTT plan. And that for those who thought that such a plan had lost momentum when the legislature didn't vote to move child care licensing, I'll say no momentum was lost. It is DEAD dead. Those agreements, those plans are over. They existed only for that one purpose. I raise objection to the lack of transparency in how money is spent, what children are served, when and where they're served, and by whom. The only transparency DECCD offers is its motives, and those we can see straight through. E-child care is a red herring tossed out to rally the troops and distract us from the system that damages, if not destroys, minority-owned businesses and the source of income for home providers. 37% of our households with adults and 44.9% of our households with children under 18 have either no phone at all, no landline, or are wireless. Not wireless like my smartphone, mind you. Wireless like you go to Walmart and when you get a little piece of money, you buy a little piece of time. Those things do nothing. And then 16.4% of our households are unbanked. 33.2% are black, 5.8% are white. So the only home providers that can participate are those who have a landline phone and a bank account. That is totally discriminatory on its face and in its practice. But particularly when you look, the DECCD's market survey reported 1,384 licensed child care centers participating in the program.
Thank you.
3,700 in-home providers.
Thank you.
And they ordered only 1,815 phones. And most of all, I object to any practice that segregates poor children from all other children, as this one does on signing. Thank you very much.
Thank you. I'm sorry, I called Debbie Ellis.
Oh, I thought you said number 2.
No, I said Debbie Ellis. I'm sorry. That's who I have as.
I'm number 2.
Okay, Miss Sue Harvey. Okay, I'm sorry, Miss Ellis.
I'm sorry, I knew where I was on the list. I apologize.
It was just scratched out, and so I was going down.
Somebody moved
and
down.
that's the one that's.
Well, I'm representing all child care centers in Mississippi.
So that she can speak, she can have her 5 minutes.
Please, thank you. I want to read a letter that I emailed, and I'm going to share it with y'all. I'm quite frustrated with the way the certificate program is handled. I am one of the first white-owned centers in Natchez, though I am diversified, to sign up for the program many, many years ago, at least 20. It is very difficult now. I had to take classes and travel to Jackson many years ago. Please understand it isn't because of the technology, but the fact that technology cannot answer questions or correct errors as they need a person to edit these mistakes. I myself must talk to someone in order to have the mistakes corrected. I feel that Human Services is jumping into yet another project, fingerprinting that costs millions of dollars, and your personnel has yet to master a plan to pay the providers. Many of the centers have not been paid for children that started at our centers. I am one of these centers. I have a child I have not been paid for that started back in June of 2012. When a parent chooses to change centers, we do what we're supposed to do and do the paperwork, and it's faxed to blank for the Southwest region. When it is time to fill out ledgers online, we find the child has not been placed on the e-ledger. I pick up the phone immediately, try many, many times to reach blank. However, I cannot reach her. I have no choice but to fill out e-ledgers that are listed so I can at least get paid for these clients. I emailed Ms. Blank today, October the 8th, and listed all of the children and parents I have rendered service for and have yet to be paid for. In the past, I was always knew beforehand, arranged, and I was paid accordingly, and had listed my bills accordingly so that I would not mind getting, I'm a month behind. The government's a month behind. I knew that when I signed an agreement. That's okay. I don't have a problem with that. It is just so frustrating to have no one available to answer questions and to resolve issues as important as the child not being listed on your ledger so you can get paid. I also had a child that left my center when school closed for the summer. I did not keep her for the summer months, nor did her mother need child care any longer. I let Human Services know about this, and I also typed on the ledger sheet each and every month that this child no longer attended blank. This child should have been removed immediately and the funds appropriated to another child. This too concerns me. Parents are coming to me for help to submit personal info when they have a change of employment or income. I must admit I haven't educated myself on this and wish a class was offered to help us. We are left to go online and figure out this all by ourselves, and now fingerprinting and scanning is added. I want to continue helping parents that need and qualify for the program, but I need to have someone assist in errors that I find wrong with ledgers. My parents just received letters stating their certificates are now rolled over and their new copay amount. They did not list the full-time rate nor the part-time rate for the parent. Parents need to know this, as I myself charge the parent the difference in what they pay. All children are charged the same at our centers. I am sure it will show up on the e-ledgers, but will we have this? Will we have the e-ledger once the fingerprinting scanning is in place? Another issue I have is, how does a parent know where they are as far as the waiting list is concerned? I know some of my parents have waited a very long time and did not make the last cut. Who has the paperwork on the parents that are on the waiting list? Please help me get some understanding to the new approach to the certificate program. I would appreciate you helping me get paid for services rendered and the children I emailed to blank. I plan on attending the meeting today, which I'm here now. Let me sum it up and close with this. I myself have witnessed how much the certificate programs help families. I have many families who work or go to school or do both. Single moms and dads.
That's 5 minutes.
4 minutes.
I'm sorry, go ahead, I'm sorry, go ahead.
I myself have witnessed how much the certificate program helps families. I have many families who work or go to school or do both, single moms and dads as well as couples. Over the years, I have acknowledged firsthand the difference that this money has made in helping families. I've also witnessed women and men graduate even with honors nursing school as well as trade school. They have become self-sufficient. All of this was due to support from the certificate program. I want to see this program work, and I want to see money helping those in need. Let's put the money to work, helping our families in need. Thank you, Sue Harper.
You can come up and have questions.
Good afternoon. My name is Doris Salem, and I work in a child care center in Hattiesburg. We've been there for a long time. And this may not affect us as much as it does most of y'all, but I just had a question. Didn't know if I was supposed to sign in. My question is, what is the difference between fraud and waste?
Zealous.
I'm Debbie Ellis, and I represent Delta licensed providers as well as other child care provider networks and groups today. I wish to register an objection to the proposed e-child care method of payment through biometric finger scan machines and the contracts to be entered into with Xerox Corporation as a requirement to become a CCPP approved provider. Such a system of provider payment will deny access to high-quality programs for low-income children and cause an unintended or perhaps even an intended negative consequence of discrimination and segregation. Further, if even a small number of providers previously serving a total of, say, 25 low-income certificate children for 12 consecutive months in fiscal year 2012 withdraw from this program and refuse to participate any further as a result of the work-intensive and offensive finger scan machines, a total of $100,000 will be lost in revenue by those businesses. If the transportation costs to require training, out-of-pocket costs for rolls of paper debited from our accounts by Xerox, and the increase in payroll hours necessary to have someone manning the machines, even if only initially, total $75 per licensed provider this fiscal year, a $100,000 aggregate in lost revenue will have been realized, and I have not even mentioned the possible and future proposal of payment for actual services rendered through the tracking of time and attendance. For such reasons, I raise a formal objection on behalf of all to this amendment due to the failure of MDHS to provide an economic impact statement in a timely fashion as required by Administrative Procedures Law. I further wish to register an objection to the proposed amendment to adopt a rule of only 15 paid absent days. Paying for absence days is entirely consistent with the child care industry usual and customary practices. Providers do not let other parents opt out and not pay for days in which their child is absent. Failure to pay for absence days will deny access to high-quality programs for low-income children on certificates and is seen by policymakers elsewhere in the country as a barrier to creating coordinated policies for collaborations between Head Start and CCDF and TANF programs. In Head Start, a grantee's funding for a slot is not reduced when a child is absent. Rather, 4 consecutive absences prompt an investigation into a family's circumstances. If each licensed provider receives a yearly loss of only 5 paid absences total as a result of this proposed amendment, that reduced income reaches a $100,000 total aggregate to providers throughout this state. I therefore, on behalf of all, raise a formal objection to this proposed amendment due to the failure of MDHS to provide an economic impact statement as required by Administrative Procedures Law. And for future reference, Dr. Dent, I would like to say that the Mississippi Supreme Court frowns on retroactive enforcement of any regulation, such as one announced in June, but effective as far back as October of the previous year.
Dorothy Lewis. Okay. Petra Kay.
My name is Petra Kay. I'm the Executive Director for Northtown Child Development Center. Dr. Dent, I have the following questions. How much did it cost to develop the e-ledger program?
This is time for you to comment. We will respond with questions on the website.
All right. How much will it cost to set up the finger scan for all of the centers? Not the machines, not what they receive for running them, but for the software they will charge you. What is the urgency of the implementation of finger scanning when the pilot program has not been completed or evaluated?
Dr. Fish.
My name is V.L. Fish. My question references the child care quality grants for which the results have not yet been announced. Earlier this month, when I requested the information, I was told to come to this meeting. I am here. The research has not been previously performed regarding the goodness of fit for the system presently in place, the ERS, FCC-ERS, which would be pronounced with a word that I don't like to use in public. And the training of the evaluators has not been researched. JSU is currently researching which evaluation system would be the best fit for the children of Mississippi. There are many child care evaluation environmental rating systems, in case some of us don't know. Many more than simply that which was produced by the Frank Porter Graham Center in North Carolina. We would also like to know what training is necessary to evaluate parent-teacher-child interaction. The ECHOs, ITERs, and FCCERS do not adequately measure interaction between child, teacher, and parent. This is extremely necessary in Mississippi, in my observation, after 16 years in the state. So therefore, I'd like to know who are the new sub-grantees. Are they members of the DECCD? My goodness, we find out that Mississippi State is well represented in the DECCD, and the one place that we have seen who won the grant is the Quality Evaluation System, and they have received another $1 million this year. Yes! Gee, imagine how many children could get certificates with that $1 million. Thank you, Dr. Jan. I was proud when you received your doctorate in education administration. I was happy to see that. Unfortunately, now, I'm concerned. Thank you.
Latina Stewart.
I was just finding the
Okay. Jacqueline Hannah.
I'm Jacqueline Hannah, and I have a two-part question. Why is the contract with Xerox and not DHS? And why is the contract for 5 years?
Walter Young.
I was signing, but I yield my time to Ms. Jenny Sturgis.
You may not yield your time. You can speak. That's on the procedures rules. You may speak.
I'm fine.
Okay. Jeannie Sturgis.
My name is Jenny Sturgis. I am the owner and operator of Noah's Ark Daycare Center Incorporated, and I'm also the vice president of the Directors Network Association. And the questions that we're asking are concerns that we really would like to know the answers to. So I guess we'll have to wait and look them up on the internet. My question is, federal money given to DHS is earmarked specifically for the provision of child care. Approximately $23 million were spent on e-ledgers and fingerprinting. How can DHS justify spending $13 million on a program that is now being eliminated and over $10 million on a new program, all while serving much fewer children?
Larry Nobles.
Larry Noble from Hattiesburg, Calgary. We've got one and a half year Calgary.
Speak into the mic, please.
I'm not going to go into all things that I think's wrong with this. I think we're all covered it. My question is, why wasn't this hearing here held when this thing first started? Why didn't DHS talk to the child care providers and get their input? DHS is disconnected with the child care providers in the state. I don't know if it's intentionally or unintentionally, but they are disconnected. And this program is just, it's the wrong time. I don't like the program, but it's the wrong time to even implement it with the economy like it is. My centers, we're not going to participate. But there's a lot of centers out here with 20, 30, 40, 50% of their children on this tip. They have no choice. They've got to participate in it. It's just wrong. There's something wrong here. I don't know where it's coming from. We've never faced this with DHS before. And there's just too many questions being asked and no answers coming forth.
Carol Barnett.
I want to raise a concern about the contract being enacted with Xerox before the rule change was approved. I don't know how that could be. So I want to express opposition for the commitment of funds to this fingerprinting policy at a time when only about 15% of the kids in the state that qualify for child care are being served, and we've got a waiting list of 8,000 or so kids. And I also raise a question about enacting the policy in light of overwhelming opposition among providers and parents to the enactment of this policy. The survey that Stennis did for us showed 70% of providers opposing this policy, and expectation that that's going to lead to a deterrent effect for parents participating in the program that is so helpful to parents when they're able to get access to it. This program threatens to erode payment while the perspective from the DHS side is that it's going to save money. The concern is that money is going to be saved by eroding payments to child care providers for services rendered when that revenue is already too small and the reimbursement rate is very low. At the same time, there is a ramped up expectation for providers to improve the quality of services that they're providing that comes with the cost.
Bridget Williams. Catherine Weathersby. Oh, I'm sorry.
I would add this question. DHS states that they purchased the scanning machines. Child care providers were excluded from the decision to implement the finger scanning program. So why are child care providers included in the repair cost of the machines?
Catherine Weatherby.
Good afternoon. My name is Catherine Weatherby, an in-home provider. To all of you all, what provisions have been made for in-home providers that may have to install landline for internet service? And how would this affect us when your fee is only $40 a week per time?
This is just for what your comments.
And my next statement is this. We all gave up a lot to come here. We understand protocol. Why is it that we can't be answered?
Cora Rogers.
Cora Rogers, Executive Director of Rogers Child Care Learning Center and Memorial Education Enhancement Program. Been in operation 14 years, but I can see 4 months ahead of me. My question now is, according to the DHS policies and federal guidelines, it is discriminatory to treat voucher recipients different than paying parents. Why is it that a child care center payment policy that apply to paying parents not apply to the voucher participants?
I think this is Kimberly Kinshin, I'm sorry.
Good afternoon, how are y'all doing? I'm Kimberly Kinshin. I'm the grandmother of Sophia, a 10-month-old. Her mother is 17. We live on the coast. My husband passed away a few years ago, and so we have no other family other than my daughters and I and my grandchild. But I do have an awesome group of friends. I have friends that are beyond belief. As Hillary Clinton used an old African proverb, it takes a village to raise a child, and I have an awesome village. How many of you on the board can say that you have a village that will be there at any time that you need? My village isn't limited to 4 that help with my grandchild. How many of your friends are going to get up on their day off, rain or shine, come to your house with a smile on their face at 6:30 in the morning, pick up your grandchild so that your child can finish their education, take your grandchild to daycare, drop them off, sign them in, give them a hug, and go on about their day and back to bed with their child? Can you on the board honestly say that you have friends that have your back like that? So yes, this is the depth of love given to Sophia Elizabeth. However, some of you who are on the board live in a perfect world with a complete intact family, must be deciding the fate of others. These are people who are young single mothers and some young single fathers who are still in school attempting an education. Some are foster kids who didn't ask to be taken from their parents from the state, but were taken by the state from their parents. Others are TANF recipients. Please remove your rose-colored glasses and realize the undue burden you're creating. DHS overtook with the understanding that they would put an additional 1,000 plus children on the child certificate program. Xerox is being handed over $25 million total for the 5-year. Good job on that deception. Even though this certificate program, we must still pay nearly $200 a month out of our own pocket. Yet there seems to be a concern that there's children who are not attending daycare each day. Really, who in this crowd has an extra $186 to give a daycare and not send the child? You as a board are causing a financial hardship on me as a grandparent. The ones who help the most with my granddaughter are out working to provide for their own families. They give of their own time willingly and lovingly. So that those past the 4 who could go get my grandchild, should I be at work? Should her grandfather be at work? Should my best friend who comes every morning get her be at work? Should her grandmother who's here not be able to get a ride to go get her from daycare? What am I supposed to do with my granddaughter when she's sick and throwing up? Sorry, baby, I can't come get you. And neither can anyone else in your village. So correct me if I'm wrong on this also, but due to the fact that my granddaughter's mother and dad are only 17 years old, they're not allowed to check their child out of daycare. So you have signed an unfair injustice to young parents trying to complete their education. Is my child to drop out of school and become dependent upon the system because you choose to limit her village to 4 people? This is truly a sad but real ending. This needs to be resolved and more thought put into it. Daily sign-in and sign-out sheets are used at our daycare. And there is a lady at our daycare who has her grandchild because he is now a foster child. She's going to have to figure out someplace else to put her grandson because as a child certificate program person, he's no longer able to go to the daycare as of February 1st because his grandmother works there for a living. And also, the terminology in your writing is ambiguous to the average Joe Q citizen.
Ms. Gary, Yolanda Gary.
My question is, why is it every time that we have a public hearing and ask questions, we are not provided answers during the hearing? If the scanning system implementation has been researched and proven, I think that the director of the program and the staff should be regurgitating the answers to our questions. We hope that this hearing is not another well-prepared pacifier for providers. I called the ECCD several times and waited on hold for 15, 20, sometimes 30 minutes. Hang up, call back, leave messages. Sometimes I get someone on the line and I ask questions about this new implementation. During one of my phone calls, I was told by the employee that they were not aware of the implementation and asked me to hold while they pulled it up on the website. After she pulled it up on the website, she said, well, doggone, they are implementing this stuff. Is this the technical assistance that we have to look forward to if the scanning is implemented? And for the record, I am totally in opposition of this implementation.
N-A-W-R-O-T. Alright, hello everybody. Good afternoon. I am Sophia's other grandma, the daddy's mama. Well, I have lots of concerns about everything you said, but my main concern is my son is highly, highly upset. He feels his parental rights have highly, highly been violated. He can drive, he can work, he can pay taxes. He is early enlisted in the military, but he cannot pick his daughter up at daycare. He cannot drop his daughter off at daycare. What if she gets sick? He's got to call around, try to find someone, the 4 people, to see if they can leave work. What happens if he can't do it? What do we do? He is frantic. He's starting to lose faith in his country. He's starting to lose faith in his government. He is really thinking seriously about not joining the military because of this. He is really disheartened. He is highly upset. His rights, he just feels he has no rights as a parent. You have stripped it away. He has worked very hard. Both the mother, Megan, and the father, Tyler, are wonderful, wonderful parents. They go to school every day. They take care of her. And y'all just totally just stripped their rights away to be able to, as a family, pick her up, take her to daycare, go to school, get their education, pick her up from daycare, and go on their merry way. Go to work, go do what they need to do to make a living to support her. And that is horrible, horrible, horrible. So, my question is it true that teen parents that are minors cannot have their fingers scanned in order to take care of their children? And I have a question from Kim that she forgot to ask. She works. She's a pipe fitter. She works hard. Her hands are hard. You know, she works really hard. Okay, so how will I get my finger scanned when I work with my hands and there's so much wear and tear that they cannot scan right? What happens if they can't get it to scan right? She works government stuff, like high government stuff, and they have hard time getting her fingers to scan. What happens if, so I'm sure what y'all are going to end up getting in your daycare centers is not as high tech as their FBI and all that good stuff. You know, when they do their nuclear things that she's got to work with. So what's going to happen when y'all's cheap little scan things ain't going to scan her fingers? How is she going to pick up her grandchild and check her grandchild in and pick her up? Thank you. I'll get back.
Cassandra Welch.
I'm Cassandra Welchland with the Mississippi Low Income Child Care Initiative, and we are opposing the finger scanning. I want to submit for public record petitions that the community around the state had signed to oppose this finger scanning. So I want to submit this as public record. Who would I submit it to? Okay. There's about 50 coming, so it would be great to know how to get additional signatures into you.
Julia Eden Anderson.
Good afternoon. My name is Julia Eden Anderson, and I am from the coast. I have been fortunate to have been in child care for 28 years, both as education director for Head Start and as director of the current daycare center preschool where I am now. Upon receiving notice that SMPDD would not administer the certificate program, I personally was very happy because we were told that the money that was spent on administrative costs for them would allow more children to be served. Well, that actually has not worked out that way. I was told about a month ago that we have 1,800 children on the waiting list, and I'm sure that was just for Gulfport, Biloxi, because I know that we probably have more throughout the state. My question is, and the gentleman alluded to the same question, have you received any input? Did you seek out any input from providers prior to actually implementing this program? And what's going to happen when you realize that this program is going to be more of a liability than an asset, and the money that you have done wasted to pilot this program could have been used to serve needed children?
Hold your comments so she can have her time.
It will really be sad that in a year or two you realize that the $1.6 million that you spent was total waste, and those children have moved on and have not been served. We're going to have more children at home receiving no type of early education. And why is it that Head Start does not have to scan? And more importantly, the public school system, who accept the certificate program for after-school care, are they going to have the same procedure? Because I don't see any of them here. And it hasn't been noted anywhere that they are going to have to follow the same procedure. We need to look at the fact that children are truly our future. And we need to make sure that we understand that and that it's not just on paper, because there are a lot of children who are going to be left behind. And that is really sad.
For Sewell.
But you know it's right to do it. And you know who's on our side. I'm very concerned about the contract. I'm very concerned about the policy. But as a business owner, I see in the Xerox contract and an independent contractor, and I have an article that says that independent contractors are finding ways to get around paying employees and paying taxes. We know that if you're an independent contractor, the federal government, there's so many things that the federal government cannot do. And I've looked up several concerns under government regulations, the U.S. Constitution, for one, equal protection, the Privacy Impact Assessment, Title II, of the Government Act of 2002, and the Federal Information Security Management Act, Freedom of Information, again, social privacy, and due process, Title VI. There's so many other federal regulations that concern me in the way these things are being handled. And I think we as providers need to be clear, and we need to look a little more and find out what our rights are. In the Xerox contract, we're being required to do things that we did not ask them to do for us. Yes. We were given a contract and told, do it. Even children in your center, you don't give them a pencil and say, do it. You don't put them in the learning center and say, do it. You give them their instructions. You give them some room to decide how they want to accomplish them. You have your class meetings to help them to determine how they want to run the class. But I found a little information on Xerox that they're telling their people that they're service people. So they get around paying certain federal dollars, FICA, all these things. They get around making sure that they pay health insurance, all these. And Xerox service workers no longer submit W-2 forms or have their taxes deducted at the source. There are agents. The cities in which they work no longer get any payroll taxes from Xerox. And even more, so many dollars have been lost to the government as a result of independent contracts like Xerox. They talk about tax cab drivers and how we are going to lose money as far as the children, but how we're going to lose everything. We need to be looking at trying to find ways to help our children, not destroy the parents. And I asked this morning, and I asked again, how many of you have been on welfare? I have. How many of you have gotten food stamps? I have. I wish they had child care certificates when my children went to school. I had to pay out of my pocket. But still, so many are not afforded the opportunity and won't be afforded the opportunity because they're scared. Xerox, and I'm going to call them the big bully, they have been bullying us, calling us, and they told my director
to tell the person that, she told I wasn't there, that they need to go online, download that contract, and they better sign it. So after some of us didn't sign it, they send them signed receipt. And then, Dr. Dent, to get the letter saying we must do this, that was fine. But to say if we don't participate, that we may not be able to be in the program, you stated it differently today, but it's not written that way. And it was somewhat intimidating to think if I decide today I'm not going to sign the contract and I can never participate in the program again. Thank you.
Any man? Lily Robinson.
My name is Lily Robinson, and I've been in business for 35 years, working with children because it's in my heart. And what I want everybody that has said something positive about our concern and love for children, I just want to echo that. And I just want this meeting to be one that all the information that you gather, that you'll go back, sit at the table, look at everything, analyze everything, and we come together and try to work this thing out. Because in the end, the children, those that are not able to pay for child care, they're going to suffer. And they're going to be in homes where there's no teaching going on. So if we can just appeal to you to go back, look at everything, take everything in consideration, call us as directors. We'll be willing to meet so that we can resolve this. This doesn't have, Mississippi needs to come up. And I think we would be an exemplary state if they said, well, you know, in Mississippi, they worked that thing out, and now child care is even better. And then we want to make sure that you let the legislature and let the governor know that Mississippi needs to invest in early childhood. It's a shame for 2012. We don't have a dollar coming from this state for early childhood. So I just appeal to you, Dr. Dent, if you all would just look at everything everything that's been said, go back, let's go back to the table and let's try to resolve this issue amicable. And I believe we can work something out. There's too many smart people in this room, and even those that wasn't able to come. We just want one thing. We want these children to be exposed to as many positive things as possible. And like I said, it's in my heart, because I wouldn't have been in this business for 35 years if I didn't love the output and the things that the children are learning. Doctors, lawyers, teachers, as a result, is exposing them to early childhood education. So please, if you all would go back, I just appeal to your sense of decency. Don't let this program just wither away, because it's necessary in Mississippi. Thank you.
Those are all that have signed in that wish to speak. We will get this information on our website. We will hold trainings, so we will be able to give more information out, as well as offer webinars for trainings. So we will be back in touch with complete information for you to be able to review. Thank you.
There are many people who do not, especially parents and poor parents, who do not have access to the website. How are they going to get the information?
The webinars. Okay, we're not going to start a question and answer session because that's not what we're here for. So parents can go to the EA's site. Thank you for coming today.